We are students from Parkland's Dental Hygiene program, and in this video, we are going to discuss the correlation between the bacteria that is involved in periodontal disease and the effects it can have on patients with COPD. Aspiration pneumonia, which refers to a bacterial infection, occurs in individuals with a condition predisposing to aspiration, often including those who have experienced a stroke, have been diagnosed with Parkinson's disease, alcoholism, or COPD. Bacterial pneumonia occurs in the lower respiratory tract, which is usually a sterile environment, but the spread of infectious agents by aspiration can lead to contamination. The bacteria commonly involved include the bacteria found in the mouth and bacteria that patients acquire while in the hospital. The bacteria involved are mainly gram-negative bacilli and staphylococci. As studies suggest, 45% of healthy and 70% of patients with impaired consciousness aspirate bacteria into their upper airways during their sleep. This is considered a main cause of aspiration pneumonia. Aspiration pneumonia can occur in 3 different ways. First, there is a higher concentration of bacteria found in the saliva of individuals with either poor oral hygiene or periodontal disease. These bacteria are then aspirated into the lungs, overwhelming the immune defenses of those individuals. Secondly, dental plaque that is not removed daily could harbor colonies of pulmonary bacteria and, under specific conditions, promote their growth. Lastly, periodontal bacteria can facilitate the colonization within the upper respiratory tract by pulmonary bacteria. The bacteria found in the mouth are also involved in pulmonary diseases affecting airflow, with the most common disease being chronic obstructive pulmonary disease. The most common cause of COPD is smoking tobacco, but it has been found that bacteria in the mouth may influence the progression of the disease. Research has provided evidence of a correlation between pulmonary infections and oral diseases. The accumulation of plaque on teeth and dental appliances, such as dentures and some periodontal bacteria, increase the risk for developing aspiration pneumonia. It has been found that proper oral hygiene assists with reducing the risk of pneumonia among susceptible patients. The bacteria that causes dental decay and periodontal disease are potential risk factors for aspiration pneumonia. Many of the pathogens that are associated with aspiration pneumonia reside in dental plaque, and evidence has shown that patients with a history of respiratory infections had an increased amount of plaque than those who had not experienced respiratory infections. Oral hygiene in patients that reside in long-term care facilities is generally poor, and by improving their oral hygiene in these patients, the incidence of aspiration pneumonia may decrease, thus improving their overall health. The treatment of periodontal disease would be another way to reduce the incidence of aspiration pneumonia. Research underlines the necessity for regular dental appointments among susceptible patients and the introduction of specific oral hygiene courses for caregivers in long-term care facilities to help promote oral health. With all the information provided, we will now demonstrate how to properly perform oral hygiene, focusing on the proper brushing technique and how to correctly care for dental appliances.
To begin, place a toothbrush at a 45-degree angle at the gum line. Gently move the brush back and forth in short strokes. Brush the outer surfaces, the chewing surfaces, and the inner surfaces of the teeth. To clean the inside surfaces of the front teeth, tilt the brush vertically and make several up and down strokes. Encourage patients to brush their teeth daily, preferably morning and night. Bacteria can linger between the teeth where the toothbrush cannot reach. Encourage patients to use additional devices, such as end-tuft brush or a proxy brush, to help remove plaque and food particles from between the teeth and under the gum line. It is important to visit the dentist regularly for prevention and treatment for dental decay and periodontal disease, especially for patients who are susceptible to aspiration pneumonia.
Many people living within a long-term care facility wear some sort of dental appliance, such as dentures. It is crucial that their appliances are kept clean and are replaced if they become loose or broken. Encourage patients to clean their dentures twice a day, as well as their gums and any remaining teeth. Provide assistance if they are unable to do this on their own. Use a soft bristled brush or a denture brush in either a denture paste or non-perfumed liquid soap and water to remove all food, plaque deposits, and adhesive residue, as these can encourage bacterial growth. It is important not to rely on denture cleaning tablets, as these are not effective in removing residue. Make sure that the dentures are cleaned over a bowl or sink of water so that they will not break if dropped. Make sure that the dentures are taken out overnight and are placed in a small dish with water and a cleaning tablet.
As healthcare providers, it is important to understand and acknowledge potential consequences of poor oral health. It is our responsibility to properly educate and encourage patients, as well as their caregivers, on the importance of incorporating proper oral hygiene techniques into their daily routine. It has been shown that there is indeed a connection between the oral cavity and the body. This information has been geared towards patients with COPD. However, it is important to note that good oral hygiene practice is essential for all patients within a long-term care facility to improve their overall health and well-being. We hope you find this information helpful, and thank you for watching.